I'm Dr. Jay Hartley at Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. And recently we had a patient ask us what we can do for scoliosis. So I wanted to show you around the clinic and explain a little bit what we do for scoliosis. So the first thing we do is the patient comes in, they do a patient history, and we find out what their issues are, if they have a history of scoliosis and things like that. So follow me. Then the next thing we do is our exam. And this is our exam room, and one of the things it entails is a very specific type of exam and x-ray, very specific to scoliosis. It's very important to have a very detailed exam to know where the starting point is there ligament damage, things like that. So the very first thing is a very specific history exam and x-ray. All right, now follow me. And then we'll go over the results. If we find that we can help the patient, we go through a process called mix, fix, and set. Mix is a warming up of the spine to get it more pliable, to be able to change back to normal. So that would be the next thing we do on the care side of things. And that'll consist of wobble chair exercises, cervical repeat traction, the Eckert table, cervical vibratory traction, core stem, mechanical drop. So all of these things loosen the spine up to get it pliable, to get a good adjustment, all right? And then follow me. And then the next thing is a very specific adjustment. So we use drop table and handheld instrument to do very specific adjustments of the spine based on the patient's exam and x-rays. Very detailed determination of the proper adjustment for the patient. Okay, so that part is called the fix. So it's mix, fix, and set. And then the last thing is what's called the set. And if the scoliosis patient has over a 15 or 20 degree curve in their spine, they're going to use what's called the scoliosis traction chair. Similar to the Eckert table, it places them in a mirror image of their scoliosis, and we actually take an x-ray of them in the chair, and you'll actually see how it straightens. And our goal is to have at least a 50% reduction of the curve while they're in the chair. Sometimes if their spine's very pliable, like in younger kids, they may actually get 100% reduction or even a reversal of the curve while they're in the chair. And then the last thing they do is what's called spinal waiting. So spinal waiting is a mirror image exercise. They're standing on a vibrating platform with what's called a cantilever, and it basically reverses their spine similar to the chair, except they're standing on a vibrating platform and doing some balancing exercises. So it's like a brain-based exercise that gets the brain to get all the muscles to hold everything in alignment. We also take an x-ray of them doing that to make sure that works. And if we confirm that that works, then they do that at home. And then over a period of time, we have multiple visits, usually 12 or 20 visits. And the visits are about 2 hours long. And then at the end of that 12 or 20 visits, we do another x-ray to determine how we did. And our goal for a younger patient is to have a 30% reduction. In older patients, it's more about pain reduction, posture improvement, but many times we also will get a reduction of the scoliosis with those patients. And then once we've achieved that reduction, the goal is to hold that reduction through the patient's life. So it's a very specific exam and x-rays, and then mix, warming up the spine, fix, a very specific adjustment, set, getting everything to hold. And the idea is to get a reduction of the curve, stabilizing, keep you feeling good, and then make that happen for the rest of your life. So this has been Dr. Jay Hartley at the Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. Now go out and make yourself a great day.